A 28 years female attended gynecology unit for DNC, that means dilatation and curettage, for incomplete miscarriage. She has previously had a recurrent pulmonary embolic event. After the procedure, she is persistently bleeding. Her APTT is increased, which is 52. What is the most likely cause? Here the options are antiphospholipid syndrome, DIC, hemophilia B, von Willebrand disease, and factor V Leiden deficiency. So what may be the cause? First of all, let's see the different type of drug and condition which causes or which affects the coagulation pathway. First of all, the heparin it affects the coagulation factor, which is the 2, 9, 10, 11. Then warfarin, it affects 2, 7, 9, 10. DIC, it affects 125, 8, and 11. Liver disease, it affects 125, 7, 9, 10, 11. So this clotting factor should remember very carefully, especially the warfarin, because warfarin is very, very important, and the question usually arises from the warfarin, but other options, they are also very important. In case of the hemophilia, APTT increase. In case of the von Willebrand disease, APTT increase. In case of vitamin K deficiency, also the APTT increase. And in case of von Willebrand disease, BT, that means the bleeding time also increase. In case of vitamin K deficiency, PT, that means the prothrombin time increase. So what may be the answering option? And here another important information regarding the question, that means when there is a thromboembolic manifestation that present in this patient, that means the repeated attack of the pulmonary embolism and the coagulation issue, that means there is the clotting difficulties. In this condition, the diagnosis goes in favor of the antiphospholipid antibody syndrome or antiphospholipid syndrome. And what are the clinical features of the antiphospholipid syndrome? Here we can see the fetal loss, that means the repeated loss of the pregnancy, venous and arterial thrombosis, and thrombocytopenia. So when in this question, and this lupus anticoagulant may be present in case of the APTT is the prolonged. So in this question, there is the present of the recurrent pregnancy loss. Also there is the development of the thromboembolic manifestation, so it goes in favor of the antiphospholipid syndrome. Other option here is the DIC, but in case of DIC, usually there is present of the septic event, usually septic foci present. And in case of the hemophilia B, von Willebrand disease and factor V Leiden deficiency, they are not associated with this clinical